Today I'm going to show you how to measure your child for a PPod seating system. There are a few things you're going to need to measure your client for a PPod. A tape measure. You can measure in inches or centimeters, but make sure you state clearly which scale you have used. A ruler for guidance. A pen and paper. Position the client on a firm surface like a carpeted floor. A bed or a sofa is too soft. It's a good idea to have an assistant to help position the client whilst measuring. Make sure you add an extra inch to all measurements. This allows for variations in clothing. Remember, client comfort is everything. Position the client on a firm surface. The floor is recommended. Measurement A is the hip width and is measured in a straight line from the outside of the hip to the outside of the hip across the front of the body. Measurement B is the trunk width and is measured from armpit to armpit across the chest in a straight line. At this point, it's a good idea to have an assistant to help you. Position the client's leg at right angles, like this. So the next measurement is measurement C, seat depth, and is taken from the buttock to the back of the knee. Measurement D is the axilla height, and is the distance from the bottom of the buttock to the armpit in a straight line, as you can see here. Measurement E is the shoulder height, and is the distance from the bottom of the buttock to the top of the shoulder. Use a ruler as a guide for accuracy. Measurement F is the head height, and is the distance from the bottom of the buttock to the top of the head. Note the use of the ruler. Finally, measurement G, knee to foot, is the distance from the back of the knee to the flat of the heel. Position the client's leg as shown and measure to the back of the knee.